Welcome back to Good Morning America Health. The number of people getting plastic surgery is down for the first time since the recession hit. With the often hefty price tag and all the time required for recovery, people just aren't getting plastic surgery as much as they used to. But there are other options that are cheaper with less downtime, and get this, they don't involve a knife. Always a good thing. Here to tell us more is cosmetic surgeon Dr. Cameron Roxar. It is so great to have you back to the show. Thank you so much for being here.
It's a pleasure to be back with you.
So there's a new study by the American Society of Plastic Surgeons that is showing that in general plastic surgery is down. What are those numbers like?
You know, it appears that the numbers are down from something like 11.7 million procedures done in 2007 to something like 10.3 million in 2008. So it looks like surgical procedures as a whole are down about 10 to 20%. And, you know, it's not surprising given the state of affairs of things in the economy these days.
Sure. And are you finding something similar in your own practice?
Certainly, I think the surgical procedures are down. I think people are not in the mood to undergo surgery for especially big ticket items. However, I think the non-surgical alternatives to look better are actually up. I think there's a trend for people to want less and also spend less money in doing so.
Well, that's great. And let's talk about those non-surgical alternatives and their surgical counterparts. How much, first of all, can we save by doing a non-surgical procedure?
You know, something on the order of $5,000 to $10,000. I mean, the numbers, the difference in the numbers is dramatic. Surgery, for example, if you talk about a nose job on average would cost somewhere between $10,000 to $15,000. We can do a non-surgical rhinoplasty or a non-surgical nose job with, you know, on the order of $1,000.
Oh, huge savings. And what about a facelift, a surgical facelift versus a non-surgical?
Well, you know, in Manhattan, a facelift will cost anywhere from $15,000 to $35,000, depending on who does it. So
get a car.
Exactly. So now, you know, we have state-of-the-art laser resurfacing procedures that can really cause dramatic tightening in the skin, and they may not give you the facelift, quote-unquote, surgical facelift results, but they can cause dramatic tightening of the skin, and it could be comparable. And a procedure like that would be on the order of $4,000 to $5,000. Again, significant savings. Significant savings.
And what about chin restructuring? Is that also?
Yes. So a chin augmentation, surgical chin augmentation, which involves putting an implant in, could cost anywhere from $5,000 to $8,000. Again, we could do a non-surgical chin augmentation these days, and that would cost on the order of $800 to $1,000.
Okay, great. So now that we understand a little bit about the savings, let's talk about the procedures and what we can actually expect from them. Let's start with the laser resurfacing versus the facelift. How long would the recovery time be, first of all, and how long would the results likely last?
You know, so what we're doing in a facelift is you're actually making an incision around the ear, and you're kind of freeing up skin, and then you cut the extra skin and you sew it back up. That's what a facelift is. And a facelift has downtime anywhere from 1 to 3 weeks, depending on how aggressive that facelift is done. Laser resurfacing, what we're doing with the lasers, we're actually taking away a layer of skin. And we can do it with state-of-the-art lasers like Fraxel Repair, which uses the fraction and beam of the CO2 laser. And what that does is gently resurfaces the skin. And by doing that, the beam of the laser is able to contract skin. So you have a little bit of downtime, 2 to 3 days of rawness, but you can actually get dramatic tightening in terms of skin and also wrinkle reduction.
Sounds great. So 2 or 3 days of downtime, huge savings financially, and you say great results.
Great results, and it's natural also because it's your own skin that's remodeling. So sometimes some people complain about the unnatural appearance of facelifts, for instance, the wind tunnel appearance we hear about, like you've been through a wind tunnel, the pulled back look. With laser resurfacing, that's not going to be the case because it's your own skin that's remodeling and tightening
up.
And
how long does that last?
The results last 5 to 10 years.
Oh, that's fantastic.
Yeah.
That's great. Let's talk about some of the other ones. What about the non-surgical rhinoplasty? How does that work?
Basically, you know, in a surgical rhinoplasty, again, in surgery, what we're doing is we're, breaking bone, or we're taking away cartilages. We're basically taking away things to make the nose look more regular in look. But in the past 5 to 10 years, we've actually learned that sometimes by adding things as opposed to subtracting things, we can achieve similar results. So in a non-surgical rhinoplasty, what we're doing is we're sculpting. We're actually using a filler substance to go in there and mold the nose to the shape that we want it to. So if you have a bump, a dent in your nose, a sideways deviation, an irregularity on your nose, or if simply you want to raise your tip, we can achieve all those things simply by going in and using a filler substance. And the filler substance I like to use for that procedure is right there, Radius, which is made up of calcium hydroxyapatite.
So it's natural.
A natural substance, calcium we all have in our bone and our teeth. And so you inject the material and you mold it to the shape that you want. The results are temporary. They last up to a year. However, it's simple to do. It takes 10 to 15 minutes. It can be done in your lunchtime. And if you're, want to look good for that interview, that job interview you're going to, you can just do it and go about your business.
And recovery time is nil.
There's no need for downtime or taking time off from your work.
And you said how much is that again?
That's about $1,000.
About $1,000. Great.
And it's done all under local numbing cream.
Right. Oh, that's fantastic. In and out.
In and out.
And what about the chin restructuring? How does that work?
The chin restructuring, again, it's the same concept. Instead of putting an implant in surgically, we can just go in with injections. And again, I like to use Radius for that procedure also. And you can inject the material and mold it into the shape of a natural chin to augment the chin. And it goes to non-surgical rhinoplasty and non-surgical chin augmentation really go hand in hand in certain individuals.
They sound very similar. Yep. And what about the non-surgical eye lift? First of all, how much would that cost and how long does that last?
So again, in the surgical eye lift, what are you doing? As we age, there's certain things that happen in the eyelids. The upper eyelids kind of droop a little bit.
Right.
There's extra skin there. The lower eyelids, people complain of bags in the eyelids or hollowness in the eyelids. The fat pads protrude out. In a surgical eye lift, in the upper eyelid, you actually go in and cut skin off. In the lower eyelid, you can take the fat pad off surgically. In a non-surgical eye lift, we're actually contouring, again, the lower eyelids with a filler substance. For that procedure, I like to use Restylane.
Okay.
It's a natural sugar we all have in our skin. And so you go ahead and you inject the areas and you inject the groove that we have in the lower eyelid to basically camouflage the irregularities in the lower eyelids.
So great. Well, Dr. Rockstar, these are great options. I'm sure our audience is really excited to hear about them, especially now during these challenging times. Thank you so much. And you can get more health and wellness news by logging on to the health page at abcnews.com.